It's so great to have all of you here today with us and with some two individuals that really have made an incredible contribution to mitigate misinformation in two different ways, one at the physician level and one at the community level. And we're going to hear about both of those today. But I always like to ask, how did you get here? How did you think that you would be in this space of misinformation? So Hussein, tell us your story about how you got interested in this subject and kind of your life story that kind of built to this moment.
It's so great to be here with you and with all of our guests. Thanks to the foundation for hosting us for this really important conversation. I think it's a beautiful question. I'm a first generation Muslim American from Dallas. I grew up in a low income household, the son of two hardworking parents from Pakistan and Kenya. And I was inspired to actually go into medicine because of watching the compassionate care that my grandmother received from her lung doctor as I was growing up in the hospital, in the clinics, watching her receive care for her COPD, even though she never smoked a day in her life. And I saw the impact that trust that was built between her lung doctor and our family and her. And so as I went through my journey and I was confronted with the pandemic in the early days, I was a frontline medical provider as an internal medicine resident at Parkland Hospital, which is the main county hospital that serves low-income folks in Dallas County. And I was working in the emergency room and on the medicine floors and the intensive care units. And I was taking care of patients struggling with COVID. And on the one hand, I was watching young people and old people suffer from COVID, struggling to fight on the ventilator, listening to the cries of their family members on the phone as we were updating them, and they couldn't come into the clinics or in the hospitals. And in the meantime, I was also in clinic on the other days in my primary care clinic, caring for patients who had a lot of questions about the vaccine, and they were really concerned. And I remember one in particular, and she was a hardworking nursing home care worker, and she was very concerned about her fertility and something that she had read on Facebook and on WhatsApp about how taking the vaccine she thought might impact her ability to have kids. And so and she happened to have some high risk conditions like diabetes and high blood pressure. And she was worried that getting the vaccine was going to be problematic for her and her family. And I remember going through and having those important, tough conversations in clinic and thinking, wow, this was a pattern of lots and lots of questions coming in about things that we didn't really hear about for very long before. And a lot of it was stemming from things people had read on social media. And on top of all that, the third thing was I had a close family member who was a high-risk individual. And this person was recommended to not get the COVID vaccine by her doctors. And so I was really worried. I'm watching people die, trying to care for them. I'm having conversations in clinic with my patients who are concerned, and I'm worried that my family might be at risk personally because they're not going to be protected. So that really pushed me to join this work, and I'm excited to tell you more about it as we go along today.
You were affected right in your training, and it really did direct your future activities. It's great that a person in fellowship could begin to take leadership and lead from where you stood. David, you have an interesting story. How did you get to be involved and work with Critica?
Yeah, sure. So I like Hussein, I just want to say thanks for this opportunity. It's wonderful to be able to chat with you too about this. It's such an important topic, and I love kind of the opportunity to really listen to Hussein and kind of tell the story about Bakuna Teja, and hearing his story kind of reminds me a little bit of kind of what I faced as well. Like as a clinician, one of the things that I found really interesting, kind of throughout my medical career, has been some of the challenges in communicating with patients, and just how important kind of building trust to be able to have those relationships it really is, and it's foundational. One of the things that I found is through my background, I was born in Saudi Arabia. And I later kind of spent some time in the Middle East doing a lot of global health work. Have spent a lot of time learning Arabic, and I have spent time kind of even getting certificates of medical interpretation. So I've been very interested in kind of the communication challenges that surround kind of the doctor-patient encounter, obviously from the perspective of language, right? But also the number of times that we can have miscommunications, even when we speak the same language, just because of different communication styles, different kind of, preferences on whether or not we speak directly about kind of difficult topics or speak indirectly, and just how much this centers around a lot of factors that relate to trust. So I've been, this started a whole kind of trajectory of interest in during residency and thinking about ways that we communicate as physicians to do things on every single day, that we're told to do things like reassure patients, but we're never really taught how to do that. And sometimes, unfortunately, when you read the medical literature about reassuring patients, it tends to put the blame on patients when patients are not reassured, rather than asking the question of, are we doing a good job of teaching physicians how to reassure patients? And so this really kind of got my thinking a lot about kind of medical communication, communicating in clinical spaces, and seeing some of these divides in some later work that I did looking at chronic Lyme disease, and just how much communications seem to center around kind of this division between patients who identify as having chronic Lyme disease and the medical community in which I was trained that doesn't necessarily see chronic Lyme disease as an illness, that would say that there's still a lot of uncertainty around that.
Yeah.
And just how much those...
You had an interesting story at UPenn.
Oh, yes, I did. So my undergraduate, I worked for 3 years in the laboratory of Drew Weissman and Katie Carrico, who were some of the main foundational pioneers for the mRNA vaccines. And this is one of the things that kind of helped solidify my interest in medicine, and why I ended up being very interested in the intersection between medicine and social science, because the work that they did was fantastic, but I also saw a lot of, even the work that they did took a long time to kind of really generate buzz and kind of uptake. And so there's a lot more that goes into science than just good science. And so that set me on the trajectory of kind of understanding some of the social factors around medicine and science. Thank you for the reminder, Daniel.
And it's interesting, without me provoking any of two of you, you talked about trust and the importance of trust, and we'll get back to that. But I wanted to get back to Hussein and talk about the origins of the organization that you and your colleagues started, This Is Our Shot, and what its founding was, what its purpose is, what its mode of intervention is. And I just to give you background of what his company is about, think about all the bad stuff being said in certain quarters about people who were trying to follow the science, and remember that anger, that virtual rampage against physicians or anybody talking about science. So Hussein, take us back to that moment in time, which really was 2 years ago or less, when things were just vitriol in the social media space.
Yeah, thanks, Daniel. I'm happy to. So, for me, our journey with starting This Is Our Shot and Vacunate really began very organically. Back in December of 2020, I received a text message from a good friend of mine named Atul Nakasi, and one of the co-founders of this organization. And he said, hey, we're getting together, a lot of our friends, in a couple days to talk about this, to talk about what we can do to share our stories about the vaccine, because we're getting so many questions and there's so much confusion about the vaccine. Will you join us, in a couple nights on this Zoom call? Why don't we talk about what's going on together? And and they had actually started these conversations in Los Angeles and California about a month or two earlier through the California Medical Association. So I joined this call on a weeknight, and it was a couple days before the first COVID vaccine was about to be authorized for emergency use by the FDA for use. And here we were, small boxes on a screen, 50 more of us, trying to figure out what we're going to do. A lot of us were doctors and nurses and pharmacists, and it was, a bunch of friends and colleagues and friends of friends. And that night, we decided that we were going to try to use the power of social media to share our voices collectively, and to do that, as a united front when the vaccines came out, just in a couple days. And so we that night brainstormed the name "This Is Our Shot" together as a group, really as a play off of Hamilton and taking my shot, and this was kind of our shot together to essentially save humanity from a really bad once in a century pandemic. And that was the beginning of a really special journey. A couple days later, we started posting our vaccine selfies and stories, and pretty soon there were tens of thousands of frontline medical providers, doctors, nurses, pharmacists, students, trainees, lots and lots of people sharing their personal stories with photos and short videos, really catalyzing this private act of vaccination into a public good that everybody could see on social media. And over time, we realized that as cool as the vaccine selfie movement was, it was just the tip of the iceberg when it came to dealing with this massive problem of pollution in our information environment on social media and in communities. And so we started to follow, we developed a strategy which has three main prongs initially to try and attack the problem. And the first one was growth. The second one was education. And then the third piece was engagement. And I see a lot of some of our friends and colleagues here who've been tremendous allies in this effort on the call. And they were really a big part of this growth effort to start with, where we organically used this peer-to-peer model of reaching out to friends and organizations of medical professionals, community organizations, and public health organizations to build a network of over 60 different local and national organizations. And the goal was to attract as many trusted messengers as possible who could then speak to their communities and their followers on social media. And then step two was education. And so we had to educate ourselves because we weren't experts in misinformation, to be honest, not something that we really learned about. So we partnered with and learned from a lot of really smart people at the Virality Project, at Project Vector. And these guys are doing something that's called active monitoring or surveillance.
Yeah,
and
talk about that, because you can't just go out there and react to anything that comes out that's misinformation. You really need to know what things are penetrating different communities, and you should be addressing them. You don't want to put a spotlight on things that you don't think will rise up and be a concern. And if you do, you're going to be the spotlighter. So how did those three organizations help you identify what you should be addressing?
Yeah,
The Reality Project and Project Vector and CDC.
Yeah, that's a great question. And you're right, there's a lot of garbage out there, but it's important to know like what is trending and what's trending in your area in particular. So these organizations used a couple of different tools in order to collate and organize all of these circulating misinformation on social media. And they produced reports and dashboards on a weekly and sometimes more frequent basis that helped us to identify the major themes that were circulating. And for anyone that's interested, you can go to Project Vector currently, and you can sign up to get access to the dashboard that's available for individuals who may be interested in learning about what's happening in your general region. And so we utilize those themes that we picked up, and we developed messaging. So that was the second part of the sort of program aspect, which was preemptive messaging based on current events and educated guesses, but also some reactive messaging to the false information that was out there. And we took that information and we put it together with our team of really hardworking, smart people in medicine and public health and communications. And we collated all that information into like a weekly email and to a bunch of social media, essentially posts, assets that we could share with people. And a lot of the organizations that are here and that were on our coalition, on our team, they were helping to disseminate that information to thousands of individuals who were then hopefully being able to utilize some of that in step 3, which is like engagement with their communities, within the clinics, and also on social media. And we knew that education was going to be a big part of this. So I'm happy to talk more about that if you'd like.
Okay, thank you. Let's turn to David. There's an organization that he works for called Critica. So tell me, why it was established, its origins. I was just listening to the videotape of the founder, Sarah Gorman, who tells a great story about not wanting ever to go to a ballet when she was 4 years old. And you might want to tell that story, David, and how she was asked for a date, and the date was go to a ballet. And she had ingrained in her mind since she was 4 years old, ballet, bad, and how she began to change her mind. I thought it was a fascinating story. Maybe David, you could answer that. Why was it established, and what was Sarah Gorman really trying to tell us in that story?
Sure. Well, I mean, I definitely recommend everyone to check out Sarah's TED Talk, where she kind of goes through a little bit of some of her own personal story and how she ended up kind of in this field, especially looking at vaccine hesitancy, where she's been looking at that for a long time. So, I mean, I've been working with Jack and Sarah since about 2017. Jack and Sarah are a father-daughter team that wrote the book, Denying to the Grave. Essentially looking at the psychological underpinnings of science denial. The first edition came out in 2016, and I'd read some book reviews, and there was actually a feature article in the University of Pennsylvania Alumni Review kind of about this father-daughter team. And so I had read that feature article, and I got in touch with Jack and Sarah when I was moving to New York. And was very lucky to meet up with them. And we shared a lot of similar perspectives because Jack is a psychiatrist. Sarah kind of comes from a perspective where understanding a lot of the psychology behind science denial. And me as a sociologist and a physician, I think about things very structurally. And so it felt like a very good merging of our interests to understand kind of the reasons why misinformation propagates and some of the reasons why certain people, different communities might be more susceptible to misinformation than others, and kind of just the flows of misinformation and the structural factors that enable those flows. So since 2017, we've been collaborating together on a number of different projects. We originally were trying to, we got our first grant actually in 2019, prior to the pandemic, to study misinformation about water quality in different communities. And I'd be happy to go into the details of that, but we were working on that grant for just a short period of time before we ended up needing to change our topics, because with the infodemic that sparked up around the pandemic, there was just such a need to be focusing on misinformation around COVID-19 and subsequently the vaccines that we ended up changing our topic. The focus that we've taken has really been about what has evolved into what we now call community-oriented motivational interviewing. But it was the idea that we need to partner with online, our focus is generally in online spaces, but we need to partner with online communities, because that's where a lot of misinformation can take hold, as people end up down echo chambers and filter bubbles and these epistemic communities where they're kind of always hearing the same thing and all share the kind of same ideas. And that's where sometimes misinformation can really easily take hold. The best example I often give of this is the after the 2020 election, the Stop the Steal movement, which in certain communities is considered to be somewhat factual. But around medical misinformation, there's lots of medical communities that focus around and share certain specific ideas of kind of what is causing certain illnesses and what are good treatments and what are bad treatments. And that's where a lot of medical misinformation can propagate. So we try to partner with these different communities, and work with people from those communities who can speak using the language of those communities, the values of those communities, to and collaborate with them so that they have access to high quality information, so that these people who are the interlocutors between kind of experts in their communities can speak both languages, essentially. So they know kind of what are the concerns that come up with those communities. They can speak to those concerns. They can speak to some of the historical injustices that various different marginalized communities might have faced over time, and frame aspects of high quality information within those perspectives. And so our primary focus has been on vaccine hesitancy. And so we've been working in online communities that are aiming towards Black and Latinx populations in online spaces to try to address some of the misinformation that tends to propagate in these online spaces.
So give me an example of how you view what you have referred to as community-oriented motivational interviewing. How does that play out in an example in the community?
Sure. So a lot of what we have focused on is there's a lot of literature that recognizes that in clinical spaces, motivational interviewing has had a lot of success for reducing vaccine hesitancy, especially in people who have just given birth. So building on that literature, which has primarily been done in Canada, we've recognized that motivational interviewing principles, if they can be applied to other spaces, might have a lot of potential. Motivational interviewing principles include things like open-ended questions, trying to draw out someone's perspective about something, just asking them to speak about their views, their perspectives, and to understand their values, so that sometimes you might be able to find kind of these moments of intervention where there might be some cognitive dissonance or just some discrepancy between someone's values and their behavior that allows you to explore. And through open-ended questions, you can explore that with someone that you're interacting with. And our goal with motivational interviewing in this community setting is to try to do that in these online communities. But what's unique about this is in these online communities, you're not just interacting on a one-to-one basis. These are forums where lots of people can intervene. And so our focus has been to try to draw out from other people, some of the bystanders that are in these communities, kind of additional kind of like pro-vaccine information, if you will, and try to speak in ways that help reduce the intervention of folks like trolls or other people that are just trying to participate in pejorative or antagonistic ways. And so we approach this in kind of very open-ended ways. We are not there to just kind of, put the smack down on people, or kind of, we're not there to own the libs or anything like that. We're really there to try to kind of be curious and draw out people's perspectives, so that we can help explore those and how those relate to community values. And so one example of that is we sometimes reframe the way that people talk about things. For example, if someone says like, oh, I'm not going to get the vaccine because, I'm so sick of all of these, vaccine mandates and no one can tell me what to do with my body. One of the things that we do is we try to reframe that and say like, absolutely, like it's really important that you're thinking about this in ways, because like the vaccines really affect all of us, right? And we try to affirm self-efficacy, that we are kind of like able to make our own decisions about our health. But then we reframe a little bit and say something like, well, I can understand your concerns about kind of, freedom or, vaccine side effects or whatever. And we say, but, one of the things that I'm really concerned about is, my grandmother or my community. And I feel like, there might be some risks with the vaccine, but I feel like those risks are small relative to the benefit that I might be able to offer to my grandmother or my community, or depending on kind of the community's values, kind of just reframing someone's concerns about the vaccine towards the benefits that the community might share, and that reinforce those community values.
Right. Thank you. Hussein, I want to bring you in. You've done some community work. Can you talk about that?
Thanks, Daniel. Yeah, David's points is spot on here about the importance of community engagement. I want to share a little bit about our work at Vacunate Ya, and this is our shot, and specifically the work at Vacunate Ya, where we've really built over the last 2 years a tremendous team of Spanish-speaking medical professionals and leaders who work together and partner with community-based organizations, mostly Latino organizations, to really connect with and get the message out about a variety of things, but specifically in the early days around the COVID-19 vaccine. And it's the idea of pairing a trusted messenger, a physician, a nurse, a pharmacist, with a local community-based leader. That might be a religious leader, it might be a social worker, it might be any number of other existing trusted messengers, and then hosting events together to ask questions, to share information. And you can leverage the power of social media, what we say digital to local, whether you're using Facebook Lives, Instagram Lives, whether it could be, Zoom related events, other types of Clubhouse events, which really allow you to connect with people, meet them where they are, and have these really important culturally sensitive conversations. We partnered with a number of community-based organizations. One of them is called Ventanillas de Salud, associated with the Mexican consulate, and a number of other groups, including also at Charles Drew University, where we were able to host a group of different webinars on really important topics that were timely. So how to communicate with parents about children's vaccinations, how to communicate with pregnant individuals, how to sort of have these different conversations with different folks. And we also hosted a whole host of other educational sessions with the Public Health Institute and the California Department of Public Health, leveraging those communities to share this information. And by and large, I see this question here about evaluating success, which is a really good one.
Yeah, good one.
Results have been, it's a great question, because it can be challenging to evaluate what success looks like. For us, that was in the form of doing surveys for quantitative evaluation and then interviews for qualitative evaluation. So we found that with our 60-minute training that we hosted to help people have more effective conversations about COVID-19 vaccines, or in the early days, we found that in our pre-surveys, about 50% of people felt comfortable, confident to have that conversation with a friend, family member, or someone in their community. And after a 60-minute training, self-reported confidence went up to 80%. So, and that was, a 30% absolute increase, which was just one way of evaluating our work. And our qualitative interviews were pretty positive. People actually really enjoy having that safe space and that community to have those conversations. They're tough, they're sticky. They don't necessarily, they're not always spaces for these types of conversations with trusted messengers. They often happen in households or in trusted spaces in person. But during the pandemic, providing that space in itself and that judgment-free zone was something that came up as a really important way to measure of success. But I think there's definitely room for opportunity here in improving how we measure any interventions.
Right.
And there's a lot of things we can talk about in that front as well.
But I think your example brings out the importance of context and knowing communities through people who have the lived experience of the community. David, how do you evaluate the work that you do?
Thanks, Daniel. It is a really great question. I would say in the misinformation space, this is a very large challenge because one, there's very few interventions to try to address misinformation, especially in online spaces. There's some very good interventions in clinical spaces, and I think there's a lot of well-established tools to evaluate that. But in online spaces where like Vacúnate Ya and This Is Our Shot and where we work, it really is a bit of an open field. And part of the reason there's a huge problem with this is social media platforms do not really allow the transparency that would facilitate appropriate evaluation of these interventions. And the challenge of that is that has made it so most researchers struggle to be able to do this work. And I would say it's been very challenging. And so it's led to a little bit of an absence of appropriate evaluations in this space. And so what we've done is similar to Hussein's project. We focused on qualitative evaluation and we focused on quantitative evaluation, leveraging a lot of tools from medicine. I think medicine, public health actually offer a lot of ways that we can evaluate this work, particularly around implementation science. We use the RE-AIM framework. There's also quality improvement, PDSA cycles. kind of, because we're really kind of building the ship as we're flying it. And so trying to wait the few years that it might take to do randomized controlled trials really isn't the environment that we're in. So we've taken the approach that we really need to just start working in this space, and then try to do the best evaluations we can so we can iterate and try to improve on the intervention that we're doing.
Given some policies of unspecified social media heads, have you been seeing an increase in misinformation in recent days?
I'd be happy to mention this one, but Hussein,
Yeah,
I'm
please,
very
David.
interested in your opinion too. But the short answer is it depends on the platform. But the short answer, Daniel, is yes, in the sense that Twitter, especially, has changed some of its parameters, and there's a lot more, not just misinformation, but I would say the tenor of the conversation has changed and is much more combative. Facebook is also kind of changing some of its content moderation. There were some content moderation policies that were in place during the pandemic, and it seems like social media companies are very interested in taking those down, which in my opinion, is premature.
Husan?
Yeah, I agree, Daniel. It's a cesspool out there in some areas, so you got to be careful where you are. Most people may not be exposed to this stuff in their daily sort of usage, but depending on the community that you're in and the platform, there's definitely been a lot more hate speech and discrimination and false information flying around on a couple of the platforms, including Twitter, like David mentioned. So it really just goes back to like one of the challenges that we face and that we all face in this effort broadly is that when you try to do a social media intervention, that is based upon the structural design of the platform. And you're trying to sort of utilize what you know about the algorithms, what goes viral, to sort of, utilize them to your benefit. And oftentimes, the sort of elements of what makes something go viral are utilized very well and correlate well with things that they're not necessarily true. And so, but at the end of the day, there's only so much you can do without having structural policy reforms in a space that's actually it's a private platform that we all agree to use, like Facebook or Instagram or TikTok. And so it's a humbling sort of thing where we have to realize that even though it feels like the real world and like public discourse, it's not really. It's a private space that we are like owned by a private company that we all agree to join. And it feels like the real world because we're so glued to it with people using it, social media like 2.5 hours a day. So there's going to be a lot of reckoning coming soon in the next couple of months, in the next year or so, when it comes to regulating these companies.
So in your company, thank you, Hussein. In your organization, how can you teach medical professionals to take precautions to protect themselves from online harassment, which I think was rampant when you began your organization?
Yeah, that is incredibly important because, as we know, when you put yourself out there and take the risks that come with sharing true information about science and things that unfortunately have become politicized, you do open yourself up to being attacked by real or fake people online. And that can be, really emotionally harmful and also physically, depending on how things escalate. So I would recommend everyone to check out, if you're interested, an organization that we are in the same family with and partner with closely called Shots Heard Around the World. And I'll drop the link here in the chat in just a second for you to check out. Shots Heard is a group of medical professionals, public health professionals, folks who are working hard to support each other when they get attacked on social media. And there's a great toolkit that they've put out that helps you to understand how to be prepared for these attacks. Number one, what to do if you are attacked. And then also how to be aware of the sort of your avenues legally and otherwise. And they have a really nice 10-step sort of process that I think is a good place. But really, it's about having emotional support with others and having people come to your defense. And so if you go to the website, you can learn more. You could join the Facebook community if that's of interest to you. And we will, if you're interested, be having a lot more events in the coming year, this year, to really bring people together and who are interested in this type of thing. So we hope to connect with you.
I'd like to note that Hussein can talk and type at the same time.
Thanks, Daniel.
Okay, we're at the time where we could get some questions from the chat. And I'm going to ask Jamie, is there some questions? I know there's a lot of comments, but are there some questions that we could put forth? Here's one. How can...
You take it away, Daniel. There's a few.
There's a few, but why don't you go ahead, Jamie? I
Sure.
lost one.
I'll start at the top. One of them was asked by Lindsay Dirkleck, and that was already answered. And the next is from Pam, who says, we're working on a CDC-funded project with Latino youth to train them as promotores de salud. Does anyone have any suggestions for general resources on combating misinformation, not technical resources?
That's a great question. Resources, Hussein, David?
Yeah, I'm happy to share more. I think it just depends on what you're looking for. We have a variety of different like frameworks that can be helpful on how to have those conversations. There's a variety of different like in real-time news articles that you might find helpful with our existing community-based partnerships that we put out with a news group called Public Good News. That's part of our broader family of organizations. But I think if Pam has a little bit more specificity about what she's looking for, I think it's a great initiative, incredibly important. And there are folks who are doing similar type work, so we can definitely learn from each other and not have to reinvent the wheel, because it can be very time consuming.
I would just add to that. I think, Hussein, you make a great point that it kind of depends a little bit on your aim. There are a bunch of toolkits out there that aren't very technical. And there's depending on your aim and the group that you're working with, especially if you need it in Spanish or not, there's a bunch of different resources out there. Some things that I tend to point people to anyway are, Hussein, you mentioned a couple of places. There's also one place that I really like, because it's not just about misinformation, right? But it's also about people's sources, right? So one of the things that I often try to tell people is to really understand your sources. So I send people to media bias fact check, because sometimes people don't necessarily know that where they're getting their information can sometimes be really biased. I also, people, and this is very common in Spanish language, they often go to YouTube videos of certain physicians that they hear online. But those physicians, it's hard to tell if you're not kind of in the know, if you're not a clinician, to know whether or not someone is a little bit kind of, presenting non-standard advice. It's really hard to tell if you're not in that field. So there's quackwatch.org, which I'm not as fast at typing while we talk as Hussein is, but quackwatch.org is one of the places that I go whenever I'm encountering patients that I often ask them, where do you get your information? And they often kind of tell me, it's like, oh, I went to this website and here's this doctor and this doctor's saying this and this YouTube video. And I check in these resources to see, and sometimes I don't usually say like, oh, well, they're quack. I usually say it's like, oh, according to Quackwatch, they have, done X, Y, or Z. You might want to think really hard about the things that they present to you.
Yeah. Here's an interesting question. In some rural areas, vaccine hesitancy is evolved into vaccine hostility, and their angry confrontation with health department staff. Who else in the rural area could be identified who are not in the healthcare sector? Football coaches, faith leaders. Does anybody have any suggestions about who are trusted messengers in rural areas?
Yeah, Daniel, that's a great question. It really emphasizes the importance of how trust is variable based on region and person, and how different communities have different leaders. I think you named a couple of them that we know from the research and from just qualitative experience that are valuable. So Certainly first responders have a lot of trust in communities. Religious leaders oftentimes have lots of trust as well. Close family friends, if there's like local business owners who are particularly involved in the community, those people tend to be very trusted. I'm sure I'm forgetting a couple types of individuals, teachers in some areas as well. So I think, we do have to be creative about that and just recognize that, the trusted messenger study that's done by the Ad Council that comes out every year, it helps us to understand that we all are trusted by someone. You may not, it's hard to like accept that, but like your family and friends, they actually trust people trust their spouse and their close friends and family more than they trust anyone on a whole host of social issues. And that's including healthcare, but also broadly in public health and just society. So don't underestimate your own trust levels. But if you're looking for like influential, like local trusted messengers, there's also the idea of micro influencers, who are people who are on social media, who promote other things and are just popular. They might be, sharing, they might be having a personal blog story. They might be, sharing other lived experiences. So I hope that kind of gives you a sense, but I'm happy to share the Trusted Messenger study work with anyone. I'll drop the link. And you guys,
but we have some good humor out there. Local business leaders, farmers, Chamber of Commerce, but of course, grandma. And a lot of people like that comment. So tell me more about trust and how that plays into your work and how it manifests. Without trust, it's difficult to get messages, even to start a conversation about what might be the facts. So how does trust play out in your work? Hussein? Hussein, I bet you're a piano player.
oh, I wish, it's I'm not gonna. Yeah, I wish I had enrolled in those classes as a kid.
You're very facile with your hands.
How does trust manifest in my life? I mean, I think it's crucial to every aspect of my life. In the clinic, when I'm in the hospital taking care of patients, certainly that's a trust that's built over time. And I like to always say, trust is easy to lose and very hard to gain back.
But how do you build it? How do you build it online? I mean, I understand how you build it in the clinic, but how about online? How do you get that trust developed?
So I'll share the toolkit with you on that piece in a second, but the big takeaway is focus on communities. So with digital communities. So on Facebook, for example, there are a lot of groups that you might be part of, that others might be part of, and that you might consider joining. Those groups are insulated from a lot of the things that happen on the general feed. And there's a lot of trust built within those groups over time between people who share content, share ideas. There might be an underwater basket weaving group. It might be a group of moms organizing, against a particular cause. It might be, any number of sports, religious, extracurricular groups. So, and that community is a trust building space. That's one thing I would say. And then, to build trust if you want to be a trusted messenger yourself, and you're trying to build your own profile, there's a couple things that are important to keep in mind. And those are things like when you're posting, be consistent, be authentic, provoke emotion, utilize memes and imagery, utilize videos and reels and TikToks, those types of things to help build your profile. But just like it's true in real life, trust is not built instantly on social media either. It takes a lot of work, actually. And it's why, we need more funding and resources to help build out trusted messengers. The traditional funders have not believed that digital trust building is as impactful as community organizing and trust building, but I would argue it is. You just have to do it in a certain way. And so I hope that's helpful for the audience.
David, how do you gain trust in your work on a community level?
In online spaces, it's really hard. But this is where we kind of leverage a lot of, we try to take the same principles from motivational interviewing. Motivational interviewing is kind of theorized to have kind of two mechanisms by which it works. One is technical, which is like all the stuff that I mentioned before, like open-ended questions and like, rolling with resistance and building self-efficacy. But the things that you can kind of rate someone who does motivational interviewing on, it's like, are their skills good? But then there's what's called kind of the spirit of MI. right, of motivational interviewing, the relational aspects. And this is all trust. This is empathy. This is likability. This is affinity. This is competence, reliability, sincerity, integrity, right? Are they showing benevolence, right? All of these things really build trust. Now, the challenge in online spaces is being able to demonstrate those things in ways that are legible to the community that you're with. And so this is why we somewhat, our shortcut to that is by making sure that we recruit community members, and preferably community members that already have some sort of standing in that community, to speak with that community, right? Because all of those things are somewhat already embedded and ingrained and part and parcel of that whole package. Whereas if I come in as an outsider, it's so much harder. Like, I might have likability or affinity, right? But like, then all of those other things that build trust might be lacking and just take a lot of time to build, especially if you're working with communities that have historical and present day kind of experiences that lead them to have reasons to distrust you or the institution that you're affiliated with.
It's amazing you focused on the 4 areas that I think about in trust: the competency, authenticity, curiosity. Fascinating that you rattled those off. Wanted to highlight that. Hussein, why don't you do your pitch for people joining your organization? You know, you might as well do it out loud.
Thanks, Daniel. Thanks for that space. You know, we are very excited to invite anyone and everyone who's interested in building trust at the community level and leveraging social media to do that. You know, in the medical space and the public health space to join our work. You know, you can follow us on social media. You can visit our website at thisisourshot.info. I just dropped the link in the chat. Or if you're particularly interested in the Spanish speaking communities, please join us at vacunateya.com, and you can follow us on your favorite social media channel, whether it's Facebook, Instagram, Twitter. And then if you sign up for our newsletter, you'll get you'll get the inside sort of scoop on where we're headed. We are currently partnering with a lot of different organizations offering educational webinars that you'd be invited to. You could join our online communities. And then as we develop our strategy for this year, develop that further in the coming weeks, you'll have the ability to join some of the upcoming webinars and skill building sessions and get access to, talking points and other types of things on, specific public health and medical issues. We're in a different kind of space right now. As you can imagine, we started off with COVID being number one priority for all of us. It dramatically changed our lives. But as you know, we're dealing with COVID fatigue. The public health emergency is ending soon. People have really moved on to focusing on many other elements of their life. So we're in a transition phase, just like many of you probably are, and we're really focusing on building these skills and education of trusted messengers to be able to share that with others, because we really think that that's the most powerful way that each of us can impact our communities. So we invite you to join us, and please reach out.
So David also is available. They have done consulting with communities. So these are both non-for-profit organizations. In fact, I don't think Hussein is just a volunteer in his company. So he does this in his spare time. But I wanted to know, what is the next frontier? It was vaccines. What do you think is what area do you think? We talk about a lot about this. Where we think the puck is going? Is it going to reproductive rights? Where do you see the horizon for misinformation? It's not going to go away. I think many people thought that COVID was just a warm-up for vaccines generally, and for other things as well. So where do you see that going? David, I'm going to put you on the spot.
Sure. Daniel, I'd actually reframe it a little bit, because you're talking about where medically it's going to go. And I'll say technologically, it's already gone to AI, right? So ChatGPT is exactly what we need to be worrying about. Because with ChatGPT, I don't know where it's going to pop up, because it could pop up anywhere. And the problem with ChatGPT is that it really, misinformation has been a problem forever, right? Why is it a major problem now? It's because the speed and the scale with which social media allows its propagation. And now with ChatGPT, that speed and scale just went up an order of magnitude. That's what I'm worried about.
Yeah, that's fascinating. It's built, it's taking things from the ether, and the ether has misinformation, and it's just
The verb I heard is hallucinates. It hallucinates facts.
That's right. And the biases, of course, are built into it. Jamie, I've been a bad moderator. I've not looked at the chat. Anything that we want to bring up in the next few minutes?
Yeah, Hussein and David both touched on this a little bit, but not quite. Lindsay asked, how can the medical community empower younger clinicians specifically to become more active on social?
Yeah, that's a great question, Lindsay. And I think, one thing that we've tried that we could certainly use a lot more help and support with, that I think is key regardless of which issue you're working on, but it's around really empowering and partnering with young trainees. A lot of young people are already on, most of them are on social media. They're utilizing it pretty effectively. They're either consumers or producers or a little bit of both. And when it comes to medical trainees, is what I heard you say, medical schools, pre-med programs, nursing schools, pharmacy schools, physician assistant schools, nurse practitioner schools, all of these schools are a tremendous place for growth, education, and outreach. And so I think, if you look at national organizations that, are recruiting members, many of them have school-based chapters. And that starts all the way down in, elementary school for some organizations. But for the medical community, I think it really begins in some of these, in the early stages of medical training schools. So I would look there as one place to start, and perhaps partnering with some groups that are already doing some chapter work there. Maybe one place if your organization has sort of limited capacity. But one thing I would just say is it's hard to, when you're recruiting folks, it's about and to join the effort and the work, there's always that sort of tension of, are they joining for their own self-promotion or are they joining for the organizational cause? And I would encourage everyone here to think, carefully about that aspect of it in terms of how strategies that you use and sort of flexibility that you have and offer and invite, because there can be sort of, different motives based on some of this work.
So David, you put a comment in the chat, and I wanted you to bring that out, this notion of training public health organization, professional organization, and I think that you coined that word.
I personally did not. It was coined back in 2003 by Gunter Eisenbach. But if we have an infodemic, then ideally we would have, not just, epidemiologists address epidemics, infodemiologists address infodemics. So this is something we're always happy to to work with community partners and public health organizations, professional organizations, if they're interested in figuring out even where to start on how to address this, or if they have ideas on people that can speak to kind of particular communities, we're happy to work with them on particular trainings. I did want to build on what Hussein was saying about more communication training in medical school. And I know that the last building trust webinar discussion was essentially looking at better ways to do communication in medical school. And it's one of the things that communication is assumed to be innate in physicians, right? We don't train physicians really on how to communicate or what to do if the communication style that you're using isn't working. So, social media is just, I would say, one piece of that larger kind of missing component of medical education, which is a heavier focus on making physicians good communicators.
Yep, and I've been advocating at my alma mater, University of Michigan, no communication courses in the public health school. How can that be? They should actually, I've been advocating for a department that would really address misinformation and communication. I think it's going to be, an important discipline that we're all going to need to learn, because misinformation is not going away.